Precocious puberty in children. Causes and prevention. Precocious puberty is a condition in which a child develops secondary sex characteristics, such as breast development in girls, enlarged testicles in boys, before the age of 8 in girls or 9 in boys. This condition can affect a child's physical, psychological, and long-term health. Causes of precocious puberty in children. Precocious puberty is divided into two types. Central precocious puberty, due to early activation of the hypothalamic pituitary gonadal axis, and peripheral precocious puberty, due to sex hormones produced from other sources. Causes include 1. Causes of central precocious puberty. Genetic factors. Children with a family history of precocious puberty are at higher risk. Neurological disorders. Brain tumors, brain damage due to trauma, encephalitis, or congenital abnormalities, such as hypothalamic tumors. Precocious activation of the nervous system. Premature activation of the hypothalamic pituitary axis without a known cause, common in girls. Rare diseases. McCune-Albright syndrome, congenital adrenal hyperplasia. 2. Causes of peripheral precocious puberty. Hormone-secreting tumors. Tumors in the ovaries, testicles, or adrenal glands that secrete estrogen or testosterone. Exposure to exogenous hormones. Using creams, medications, or supplements containing estrogen, testosterone, e.g. hormone creams, supplements of unknown origin. Thyroid disease. Prolonged hypothyroidism can cause early puberty in some children. 3. Environmental and lifestyle factors. Endocrine-disrupting chemicals. Exposure to substances such as BPA in plastics, phthalates or parabens in cosmetics can trigger early puberty. Obesity. Overweight or obese children are at higher risk because fat tissue produces estrogen, triggering early puberty, especially in girls. Unbalanced nutrition. A diet high in processed foods, high in sugar, or fat can affect hormone balance. Exposure to artificial light. Using electronic devices too much, especially at night, can disrupt circadian rhythms and affect hormones. 4. Psychological and social factors. Severe psychological stress or unstable living environment can indirectly affect the endocrine system. Children living in an environment lacking parental care are at higher risk in some studies. 5. Unknown cause idiopathic. C. In many cases, especially in girls, precocious puberty has no specific cause and is considered idiopathic. Symptoms of precocious puberty. In girls, breasts develop before age 8. Menstruation begins early, usually before age 10. Pubic and underarm hair appear early. Height growth is rapid initially, but may be shorter than peers in adulthood due to early epiphyseal closure. In boys, testicles and penis enlarge before age 9. Pubic, underarm, and facial hair appear early. Early deep voice. Height growth is rapid but may stop early. General symptoms. Body odor similar to that of adults, due to active sweat glands. Early acne. Psychological changes. Irritability, anxiety, or age-inappropriate behavior due to hormonal changes. How to prevent precocious puberty. While not all cases of precocious puberty can be prevented, especially when linked to genetics or medical conditions, the following measures may reduce the risk. 1. Maintain a healthy diet. Feed your child a balanced diet rich in vegetables, fruits, lean proteins, and whole grains. Limit processed foods, fast foods, and foods high in sugar or trans fats. Avoid foods or supplements suspected of containing hormones, such as milk or meat from animals fed growth hormones. Add foods rich in fiber and omega-3s, salmon, chia seeds, to help balance hormones. 2. Control weight. Encourage your child to maintain a healthy weight through diet and exercise. Monitor your child's body mass index, BMI, to detect early overweight or obesity. Increase physical activity such as playing sports, swimming, or jogging, at least 60 minutes per day. 3. Limit exposure to endocrine-disrupting chemicals. Use water bottles and food containers that do not contain BPA or phthalates. Avoid cosmetics, lotions, or personal care products that contain parabens or questionable chemicals. Wash fruits and vegetables thoroughly to remove pesticide residues. 4. Reduce stress and improve sleep. Create a positive, stable living environment for children. Encourage communication with family. Make sure children get enough sleep, 9-11 hours per night depending on age, in a dark, quiet space. Battery. Limit the use of electronic devices, phones, tablets, before bedtime to avoid disrupting the circadian rhythm. 5. Regular health checkups. Take your child to see a pediatrician regularly to monitor development, especially if there are signs of early puberty or family history. If abnormal signs are detected, such as breast development, early pubic hair, the child should be taken to a pediatric endocrinologist for evaluation. Hormone tests, bone X-rays, or MRIs may be ordered to find the cause. 6. Education and awareness. Parents need to learn about the signs of early puberty for timely detection. Avoid giving children products suspected of containing hormones, such as creams, over-the-counter medications, without a doctor's prescription. Instruct children on healthy lifestyles and age-appropriate body care. Important note: impact of early puberty. Early puberty not only affects the physical, early growth arrest, risk of osteoporosis, but also causes psychological pressure. Children may feel different from friends, worry about appearance. When to see a doctor. If your child shows any signs of puberty before age 8, girls, or age 9, boys, take them to the doctor immediately for evaluation. Timely treatment, such as hormone inhibitors, can help delay puberty and reduce complications. Do not self-medicate. Do not use supplements or drugs to control puberty without a doctor's prescription, as it can cause serious endocrine disorders. Thank you for watching the video. Wish you and your family good health and happiness.